America's largest school district returned to in-person learning Monday. More than 1 million students filled classrooms across New York City. Schools there went remote in March of 2020, just as the city was becoming the epicenter of the nation's coronavirus outbreak. Despite this milestone, the pandemic is not over yet. The American Academy of Pediatrics reported the second highest number of pediatric cases last week. Meg Oliver has more on plans to keep kids and teachers safe.
This morning, Natalia Marakver couldn't wait to take her 7- and 11-year-old daughters back to school.
I think it is more than safe to send kids back to school. They miss socialization, they miss learning, they miss the interaction with their friends.
After 18 months of pandemic shutdowns, plus remote and hybrid learning,
we're going to do it. We're ready.
New York City Schools Chancellor Misha Porter called today's reopening a milestone. With mask requirements, classroom air purifiers, and vaccine mandates for teachers and staff, Porter is confident schools are safe.
Despite all of that, there are a lot of nervous parents. How do you reassure them that it is safe to send their kids back to school?
I think what's important is where we agree. And we all agree that the best learning happens in person between students and teachers. And we have done the work to get our buildings safe, to get them ready.
Still, some concerned parents marched to demand a remote learning option on Sunday.
Love you. Have a great day.
Daniel Cohn has mixed emotions about sending his 9-year-old son back to class.
I mean, a sense of relief, but also mixed with apprehension. We don't know what the Delta variant is going to bring for this school.
Today, the American Academy of Pediatrics reported more than 240,000 new cases last week, the second highest total since the pandemic began. And since reopening this year, COVID outbreaks have forced nearly 1,700 schools nationwide to close.
How do you prevent that from happening in the nation's largest school district?
Continue to follow the health and safety protocols. Folks in New York City are getting vaccinated. Our vaccination rates are up. And that's how we build a protective bubble around our schools.
Here in New York City, roughly 75% of school staff and 65% of eligible students are vaccinated. Former FDA Director Dr. Scott Gottlieb, who's on Pfizer's board, says Pfizer could have a vaccine available for kids ages 5 to 11 by Halloween, but it's ultimately up to the FDA. Elaine?
Meg Oliver, thank you. For more, I want to bring in Dr. Dave Anderson. He's a clinical psychologist at the Child Mind Institute. Dr. Anderson, welcome. Thanks very much for being with us. So as kids head back to school, experts warn they may be experiencing more anxiety than in years past due to the pandemic. In what ways, doctor, did COVID-19 impact back to school anxiety for children? What are students currently grappling with?
To be sure, thank you for having me, by the way, but to be sure, kids have been experiencing, a lot of accommodation over the past year, even if they might have had a period of return to school in person at some point over the past 18 months. This is the first kind of real return. And so at some level, a lot of kids have grown comfortable with the kind of, rhythms of being in school and online at home. And that means a lot less of kind of being socially exposed or having their actions in class be something that's socially watched. And particularly, with teenagers, there's a certain comfort in rolling out of bed and not feeling like you necessarily have to do too much in order to attend school. So we see a lot of anxiety about getting back into those routines and feeling that pressure.
Well, CDC data published last November show that from March to October of 2020, mental health-related emergency room visits rose by 24% in kids ages 5 to 11 and 31% in adolescents ages 12 to 17. Dr. Anderson, explain why 1 year of being out of school took such a significant toll on the mental health of kids. How have their needs changed?
Well, importantly, the famous phrase in psychology is that correlation is not causation. There are a lot of factors that led to an increase in anxiety and depression symptoms across every single age range over the past year. It isn't just kids being out of school. In many ways, it's also the stress their parents have experienced. So many families have experienced financial instability or job insecurity or food insecurity. And in that sense, those things trickle down to kids and cause huge increases in stress levels. To be sure as well, with teenagers, one of the reasons why we think that mental health symptoms have really increased has been partly the isolation. Adolescence is a time when you're supposed to be exploring new things and engaging in novel activities. And that kind of, shutdown and lockdown during the COVID pandemic has led a lot of teenagers to feel, more lethargic or low mood and kind of anxious about how they're supposed to be reintroduced into the normal rhythms of life.
Well, what might back-to-school anxiety look like in different age groups, doctor? What are the warning signs that a child is struggling?
So at some level, what's important is to remember that, any big emotions are common at transitions. So we don't want parents to be concerned just because their kids are having, big feelings for little ones, or because teenagers might be a little bit more irritable or a little bit more apprehensive about going back to school. It's whether or not those things persist. There's a famous acronym in psychology called FIDI, which basically means that if things happen frequently, very intensely, they go on for a long duration, and they cause the child to be impaired either at school or at home or with their friends, that's when we really pay attention. So we're telling parents, if kids experience just kind of transient anxiety on the return to school, what we want to do is we want to validate that emotion, let them know we understand why they're feeling it, help them to focus on whatever positive aspects they can, and if they can't focus on the positive, let them know we think that they're resilient enough to get through it, and kind of nudge them into small steps toward confronting their anxiety. But should we see something that persists, for example, beyond the first few weeks of school, where a kid is really intensely anxious or experiencing huge emotions in those first few weeks, that might be the reason to seek professional help.
Yeah, that was going to be my question, doctor. At what point would you recommend to parents that they actually have gotten to that point where it is necessary to get additional help? Because it can be hard for some parents to distinguish between, what might be, quote unquote, sort of normal anxiety given the circumstances, and what might be something requiring a bit more professional guidance.
Well, this is something that relates to access issues within our country around mental health, which is that parents feel that something has to be deeply wrong in order for them to consult a mental health professional. The reality is that we hope that most people might have access to a mental health professional even when they have sort of minor concerns or just want some consultation about coaching their children through big transitions, because that's generally what we can help with. But to be sure, because most people consult a mental health professional only after they're sure that something's wrong, we want parents to be on the lookout for common signs of stress in children, which are changes in eating and sleep patterns, increased kind of high levels of emotionality, either high levels of, sadness that might persist throughout the day, or a lot of irritability, or a lot of anxiety that's increased around kind of all the different transitions that they might be going through. And as parents see those sorts of things, it's good to reach out, be able to consult with a mental health professional. And, oftentimes someone will just give you strategies to help support your child. They may not necessarily be interested in diagnosing your child or involving them in long-term treatment, because many of these things can be helped just if we can intervene early on.
Well, many parents, especially those with children who cannot be vaccinated yet, may also be experiencing back-to-school anxiety. They're now having to share the responsibility of keeping their child safe and healthy with school faculty and staff. So what are some of the biggest concerns you're hearing from parents, and how do you address them?
Right. It's this balance that I think people are thinking about in terms of relative risk, in the sense that, as the chancellor was speaking to in the last segment, schools are taking every precaution they can related to masks in New York City and thinking about how they can make sure that staff are vaccinated and children who are eligible for vaccination can be vaccinated. But for those children who are not eligible for vaccinations yet, it's an assumption of, and a thinking about risk for any parent related to the idea that schools are taking every step to be safe. And I can understand why some parents still feel anxious about wanting their children either to be able to have access to a vaccine or not necessarily feeling fully safe until that's happened.
Just so important, I think, to recognize and to acknowledge this particular component of this back-to-school transition. A lot of folks may just be sort of moving on ahead and not giving much thought to the mental health aspects of this, but it is a huge transition for parents and their children. Dr. Dave Anderson. Dr. Anderson, thanks so much for sharing your expertise with us.
Thank you for having me.